My name is Richard Rubenstein, and I'm a patient of the Mayo Clinic in Scottsdale, Arizona. Back in 2007, when I was told it was time to get my first colonoscopy, I went to my doctor, went to a GI doctor, went in for what I thought was a routine colonoscopy, and much to my surprise, or perhaps I should say to my shock, it turned out that I had stage 3 rectal cancer. When you receive a diagnosis like that, it's really earth-shattering. It's a tough thing to deal with, especially since there had been no family history of colon or colorectal cancer in the family. Also, since I did not have any symptoms at all. I have learned that the majority of cases of colorectal cancer are in people that do not have a family history. I've been told that only 30% of cancers come from a history of it. So don't use a criteria of it doesn't run in my family to avoid having a colonoscopy. It can happen to you, and if it does, again, you really want to know about it as early as possible. One of the things I did right after I was diagnosed was I talked to both of our grown kids and told them to go in and get colonoscopies. Our daughter went in at age 33 and got a clean bill of health. Our son went in at age 29 and they did find a couple of polyps, which is very unusual for someone that age. When a polyp is found early, it's removed. It's an absolute nothing. When it's left to its own devices, they become precancerous and then they become cancerous. So hopefully, for everything I went through, at least it encouraged my son to get in, get screened early, and saved him a lot of heartache and aggravation. We made the decision to go to the Mayo Clinic here in Scottsdale, Arizona, and we started the process. Went in, we met with the team. They recommended 6 weeks of daily radiation along with wearing a small chemo pump. The combination of the radiation and the chemotherapy was designed to shrink the tumor prior to operating on it. The process itself really was not bad. Radiation, to me, had no side effects. It was very comfortable. And the chemotherapy, to give you a few drugs to take here and there to ward off any side effects, and for me it was not a bad thing to do. I'm glad to say that the initial treatment was excellent because at first the tumor was measured to be about 3 centimeters, and I'm told that by the time they operated it was down to about 4 millimeters. So it involved them cutting a lot less out. So after 6 weeks of treatment, I was given the good news that they were happy with the progress. Said, why don't you go take 3 or 4 weeks and recuperate and feel good and go do something fun and then come back and we'll have surgery. Kind of hard to go have fun when you know you're having surgery, but life goes on. Surgery went fine. I was estimated to be in the hospital 7 to 10 days and was actually released after 4 days. I still had a few things attached to me, but when I promised to bring them back the following Monday, they agreed to let me go. Came back, had subsequent checkups, and they said the operation was successful. They felt they had gotten all of the tumor out and left me with clean margins. Again, go away for a couple of weeks, go home, feel better, and then come back and see us. Came back a few weeks later for a follow-up, and my oncologist said, basically, we feel that we got all of the tumor out, but it was stage 3B, and it was in sort of a bad location, and we think to make sure that there are no loose cancer cells kicking around, we should do some more chemo. I had gone through a lot of treatment at that point in time, so I went home and thought about it, and my decision was I'd had enough and I really don't want any more chemo. Well, luckily for me, there are people in my family members and family friends that were a little more level-headed, and they convinced me that the prudent thing to do was to have the additional chemo. And I admit, when you're in the midst of treatment, your decisions are not always the best. So if you have a team that you can rely on, some advocates, some people who are willing to give you their opinions, support you, people that care about you, whether it's through your church, through your medical community, family, or friends, bring them close to you, let them know what's going on and listen to them, because they are responsible for, well, my support group was responsible for getting me to take the additional chemo, which at the time I didn't want to do. Now that it's a few years past, I'm really glad I went through it and I increased my odds. I am a photographer, and by the nature of that business, I'm used to taking control. When I go into a photo shoot, I like to be able to control the lighting, control the subject, set all the parameters to create what I wanted. One of the things that I found when you become ill is that you lose control. You have to give it up to a higher power. So you need to have confidence in the people in the team that you have selected to care for you. Because your body, your health, your recovery is all in the hands of these trained doctors and surgeons and technicians and radiologists. And you know, it is a leap of faith, but it's one that we often have to take. I had my final 6 months of chemotherapy, ended in December of 2007. They said, go rest up for a while, we'll check you out. I went back a month later. They said things look great. I then went in for the surgery that they say everyone looks forward to, and that was to reverse an ileostomy, put me back together and get everything working internally again. And it was a great couple days stay. Everything went fine, and a couple days later they sent me home. I felt very comfortable at the Mayo Clinic. There is a very strong integrated approach there between all of the various departments. It became apparent really quickly that I was going to be working with a team of specialists, radiation people, lab technicians, surgeons, oncologists, chemo people. There's a ton of people. And I felt more comfortable with it all being under one roof. I kind of felt that the information flow would be more up to date. I thought it would be an environment. It made me feel comfortable. I had my follow-up visits for 5 years and was just last month told that they are completely done following me and that my odds are now the same as the general population, which could be interpreted a couple different ways since there is so much cancer out. But I am convinced that the cancer that I went to be treated for is gone, and I'm very grateful for the care and passion of the people that took care of me at Mayo Clinic.